Hello, my name is Justin Koceja, and I am a resident in the Department of Otolaryngology at the University of Texas Medical Branch in Galveston. And I am here to present this case report as a combined effort between our department and our colleagues in the Department of Pathology entitled Vanishing Papillary Thyroid Carcinoma in a Patient with Lymphocytic Thyroiditis After Fine Needle Aspiration. As we know, fine needle aspiration is the most accurate and cost-effective method of diagnosing papillary thyroid cancer today. As such, in patients with a cytological diagnosis of papillary thyroid cancer, a negative final histological diagnosis is quite rare. Thus, we herein present such a case. A 60-year-old female with history of hypothyroidism and hypertension presented with 3 thyroid nodules found on ultrasound, all meeting criteria for fine needle aspiration. Cytological analysis of the thyroid isthmus nodule, as shown in figures C and D, showed monolayered sheets of follicular cells with enlarged nuclei, pale chromatin, nuclear grooves, and pseudo-inclusions, all classic findings of papillary thyroid cancer, while the other 2 nodules showed no evidence of malignancy. 2 months later, the patient underwent total thyroidectomy and final pathological analysis was performed. On gross examination, as shown in figure B, the thyroid was a small atrophic gland covered in pale tan tissue with scant remnant of normal expected red-brown tissue. Upon microscopic examination, as shown in figures E and F, it showed the entire thyroid gland engulfed by a chronic inflammatory infiltrate and fibrosis, including the isthmus nodule that had been previously biopsied and noted to have papillary thyroid carcinoma. Upon review by 3 different pathologists, no evidence of papillary thyroid cancer could be found. BRAF immunostaining and further genetic and molecular studies were performed, and all were negative. The original cytology specimen was then reviewed again by 3 different cytopathologists, whom all confirmed and agreed on the original cytological diagnosis of papillary thyroid carcinoma. However, still no evidence could be found on the final histologic analysis. The final histological report, therefore, was signed as lymphocytic thyroiditis with no evidence of malignancy. In conclusion, in rare cases such as this, fine needle aspiration induced inflammatory changes can lead to obliteration of nodules, causing a vanishing effect of the originally seen papillary thyroid cancer, therefore causing some discordance between initial cytologic diagnosis and final histologic diagnosis. Pathologists and surgeons should be aware of this unusual clinical scenario and be able to provide appropriate counseling and reassurance to patients in these rare cases. Thank you.